just state your name.
Okay. Good afternoon. My name is Monique Talamontes. I'm on the Young Adult Leadership Council at Texas Network of Youth Services, and I'm testifying neutrally today. I'm here today because I want to share a little bit about my story with you and make a few recommendations in hopes that it will help other kids who experience what I experienced. It's not easy to summarize it all in a few minutes, but I've tried. By the time I was 14, I was put into an inpatient psychiatric hospital 3 times and an outpatient facility 4 times because of suicidal ideation, suicide attempts, and self-harm. I experienced a lot of trauma and abuse when I was younger, and shortly after my sister had passed and I came out about some of the sexual abuse I had went through, I started acting out, self-harming, running away from home, and developed an eating disorder. At one point, my family was on a family safety plan with CPS because someone had overheard my mom saying something about me going to kill myself, but they thought she had threatened to kill me. One of the times I was hospitalized because I attempted suicide, we were on the safety plan. My parents were instructed to immediately take me to the hospital and have an intake completed, and after that, I was admitted. I was also acting out a lot at school, which included a lot of fighting and skipping class. A lot of times I self-harmed, I was at school. I would often try and see a counselor at school, but I think my school only had one counselor, and she was often too busy, or I wasn't able to see her as a resource. Usually, if I could talk to my counselor, I wouldn't self-harm that day. In middle school, my mom was frequently called to school because of my behavior. I can remember her one day saying, "I just can't do this anymore. I'm ready to give up custody." She didn't know how else to help me, and she needed a break. She had a lot going on with 5 kids. My dad had been out of the picture for 4 years, which had led us to not have a close relationship at the time, but he ended up with custody of me. He didn't really believe in mental health. Instead, we dealt a lot with the police when my behaviors escalated. I was diagnosed with major depressive disorder, but he fought against me taking medications because he didn't want me to be drugged out or labeled. At the time when I, At the time when I would get frustrated, I would just walk away. One day when my dad had called the police on me for refusing visitation, I walked away from the conversation and I was tackled to the ground and had a large policeman on top of me. This was justified by my dad and by the officer because of my mental health. My dad often accused me of faking it. He had videos of me while I was in crisis, and he had told me he was recording me so that when I was older I could see how ridiculous I looked when I was faking. I was never faking. I was in pain and needed help. But he had also tried to be in the room with me during my therapy sessions. He believed since I was a minor, he had the right to be in the room. But I needed access to therapy in a safe space without my dad or any adult present. By the time I was 15, I became pregnant with my daughter. That was when I was able to get the most help to support my mental health. People started listening to me more about what I wanted and what I needed. After my daughter was born, I started seeking therapy on my own because I didn't want to put her through the same struggles. When I had my second daughter, I had severe postpartum depression, and it was hard. I was having the same thoughts I had had before. I was worried that CPS would get involved if I needed to be hospitalized, but I knew I needed help. My husband and my dad helped me identify a therapist, and I continued to work to support my mental health. And finally, I would like to make a few recommendations. First, we need more counselors and therapists in school where kids are so that they can seek help and have someone to talk to. Eventually, I was put into the CIS program where I could access a therapist in addition to school counselors, but there were still too many students and they didn't have enough time, so I couldn't talk to counselors or therapists as much as I needed to. More counselors and therapists will help to prevent mental health concerns from escalating so much. I also really think that schools need to teach kids about mental health. Like in health class, we learn what foods to eat and that we should exercise, but we should also learn how to protect our mental health and to understand when something is wrong. If everyone's learning it together, there will be less of a stigma on those like me who have nowhere else to learn it. Finally, parents need more support to navigate the system and understand what is going on with their children. I believe my parents did the best that they knew how to at the time, but they just needed more support. Even though I went through all of this as a child, I'm not sure I'd be able to navigate all that my mom did for me, for my own children, without a professional helping me understand and organize everything. Thank you for allowing me the opportunity to share my story and for working to address this important issue for our youth.